Hi, I'm Mike Magee, president of Positive Medicine, Inc., a strategic health communications firm, and editor of healthcommentary.org. I'm here to promote your participation in a free conference, the 8th Annual Ohio Linux Fest, on September 10th and 11th at the Greater Columbus Convention Center in Columbus, Ohio. My good friend Susan Rose will be there, along with other important leaders in the health information field, to encourage the development of innovative open-source software that could transform healthcare as we know it. About 5 years ago, I participated in two parallel processes that are shaping our current health information reality. The first was the development of the medical home concept, subsequently endorsed by the national organizations representing family medicine, internal medicine, and pediatrics. The second was the development of the personal health record as a fuller-bodied electronic medical record. 5 years later, we see both processes falling far short of their full potential. Why? Because their original visions were underpowered to manage the realities of aging complexity, information connectivity, and engaged consumerism. What went wrong? Well, first and foremost, the visions were provider-centric rather than consumer-centric. As I stated last year in an IOM address, medical home has been undermined by too much medical, not enough home. Regardless of the titling, the center of the medical home universe remains the doctor's office, while behavioral change and prevention reside in the home. My home-centered healthcare model turned medical home on its head, using the potential of new information technology to recenter a new preventive healthcare system in healthy homes, reconnecting the various generations of the American family and giving them well-defined rights and responsibilities, connecting our nation's silently suffering home-based informal family caregivers to the healthcare team, and most of all, converting the practice of health from a one-size-fits-all brick-and-mortar reactive exercise to a dynamic, customized, and personalized strategic health planning function that can peer forward at least 110 years for today's newborn. To manage this powerful vision, we must retool. This means new electronic killer applications, new care teams with new job descriptions, new focus on integrated and holistic healing in the home, and a renewed focus on outcomes, responsibilities, and clear definitions of the roles of individuals, families, and communities in our society. Recently, David Blumenthal, National Coordinator of HIT at Health and Human Services, in the New England Journal of Medicine, announced amended meaningful use standards, categories of performance that would be required of physicians and hospitals who receive some of the $27 billion allocated by the federal government over the next 10 years as part of an effort to expand EHR use. In his paper, Blumenthal outlines 15 core set objectives which must be fulfilled and 10 additional objectives in the menu set, 5 of which have to be chosen by participants in 2011 and 2012. While none can argue that the 25 elements listed make sense and are long overdue, a reading of them reinforces just how primitive is our current HIT status, how absent is our confidence in the consumer and the American family, and how absent is any notion of using this tremendous potential of health information technology to plan forward rather than simply look backward. In 2006, I laid out the concept of a lifespan planning record, an application that recognizes that consumer data entry is essential for the creation of personalized and customized strategic health plans. That ease of data entry and telescoping dynamic horizontal timelines are efficient tools for tracking data and maintaining a forward planning focus, and that data collected can be refashioned to create positive participatory feedback loops, a system of customized rewards that reinforce loyalty to the application, to the hosting site, and to prevention and wellness. Prevention and wellness require engaged consumers and providers who are capable of adopting healthy behaviors and avoiding health risks in the pursuit of full human potential for themselves and their families. To achieve healthy homes, consumers must anticipate, plan, coordinate, and execute consistently. This requires action that is based on good information, customized, personalized, and accessible to them. The Lifespan Planning Record is a participatory technology application designed to assist individuals and families in data gathering and forward-facing planning in the pursuit of optimal health and wellness. There's only one problem. The Lifespan Planning Record hasn't been built yet. But I'm hoping that one of you out there will act on this powerful vision and release it open source to the world. So come to Columbus, September 10th and 11th, to join the 8th Annual Ohio Linux Fest and dream big. And if you want to learn more about my vision, go to MikeMagee.org. Thanks.